This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.
Good morning. I'm Dr. Rob Page, and welcome to another podcast episode of Doc Talks. Doc Talks is a podcast that's produced by the Knoxville Academy of Medicine that features its members, the physician members, where these members give information to patients in the local community about topics that are topical, of topics that are interest to patients, to provide them with more information about how they can get additional help for areas that are of concern to them. And I feel very fortunate to be joined this morning by Dr. Rosalind Cadigan. Dr. Cadigan is an obstetrics and gynecologic doctor here in the Knoxville area. And today we're going to discuss a little bit about gynecological care, but mostly obstetric care.
Correct.
So one of the things that we had discussed sort of before we got on was when should a girl start seeing you as the gynecologist?
Yeah, and that's a great question to go over today. I get that question a lot in my practice. So the guidelines now are women should go to the gynecologist, or they can go to their family doctor as well. But generally, girls will start coming to see me at the age of first sexual activity or at the age of 21. Or if they're having problems such as heavy irregular periods, painful periods, or acne, I'll see them at any age if they're having problems. But just purely for screening reasons, it would be the first age of sexual activity or the age of 21.
So age of first sexual activity, or if there are any problems before that, and then if there are no issues prior to that, it would be the age of 21.
Right. And so 21 is the age that we do the first pap smear, whether or not you're sexually active.
Gotcha. So at the age of sexual activity, would you be doing a pap smear at age of first sexual activity in a girl of any age group, or
if they're less than 21, I do not do pap smear.
Gotcha.
So you should never do a pap smear on a woman until she's 21.
Understood. And how often should you get pap smears after you have that first one?
If you have a normal pap smear, then you should have your pap smear done annually, unless if you do what we call co-testing, where a pap smear is collected and then it's screened for high-risk human papillomavirus. Some people will do co-testing, and if they're negative for high-risk human papillomavirus, then they can wait 3 to 5 years.
Gotcha. And high-risk human papillomavirus is important because that's what's found usually in cervical cancers, correct?
Right. It's the thing that causes cervical cancer.
So, well, now, just as another aside, I know we're mainly going to talk about OB care, but I wanted to touch briefly on Gardasil. What are your recommendations on Gardasil?
So Gardasil is a vaccine that protects you from some strains of high-risk HPV. It doesn't protect you from all strains, but the ones that are most virulent or most likely to be associated with cervical cancer. It's a 3-shot series. You can get the shot starting at age 11, and it's girls and boys, not just girls. And you get 1 shot, then 2 months later, you get the second shot, and then 6 months after the first shot, you complete the series with the third.
Now, why would you think, even if you don't believe your son or daughter is sexually active, why do you think it's important to get these shots?
It's very important to have that vaccine before you become sexually active. So that's why we go all the way down to the age of 11. The ideal is to get the vaccination before you ever consider having intercourse. And it's not just for cervical cancer, it's oral cancer as well. So cancers in the mouth, on the gums, in the throat, some of those are caused by high-risk HPV as well. So that's a big argument for having boys treated as well, or vaccinated as well.
You know, it's interesting, in my realm, we also see some skin cancers that are related to high-risk HPV, and we've actually found that it helps guard against those as well. So we've talked about when you should visit your OB or when you should visit your gynecologist and what you should look for at your first visit about the gynecologist. Let's talk about obstetrical care. I'm a woman. I've just found out that I'm pregnant. What should I do?
So the first thing is you need to choose your doctor, of course. And so when you call into our office, We will book you an appointment at about 7 weeks. And the reason we wait until 7 weeks is we like to do an ultrasound for viability, or an ultrasound to make sure there's a good fetal heartbeat there. You can't always reliably see a heartbeat until about 7 weeks of gestation. So if you bring people in earlier than that, it can be very anxiety provoking. You might see a sac in the uterus, but if you don't see a heartbeat, that's extremely scary for that patient. So we generally see people 7 to 8 weeks.
And so during this first visit, where you're doing the ultrasound to assess heartbeat, what other tests do you generally run?
The first visit, it's a transvaginal ultrasound, which sounds really scary, but it's not. It's actually a very gentle procedure. But the only other thing that's done at that visit, we do what we call new prenatal lab work. So we check for anemia, we check for HIV, we check for hepatitis C, we check for syphilis. These are all routine OB screens. And we do a urine culture. And sometimes you have to have a urine drug screen as well. There's a lot of counseling that happens in that first visit. So we talk about whether or not you want to have prenatal diagnosis testing. Those are tests that can help you know if your child has something like Down syndrome or some other chromosomal abnormality. And there's a bunch of different tests. So we talk about that. We also talk about what I call my do's and don'ts of pregnancy. So I have this standard list of things I'll go through, like what fish you shouldn't eat. So you shouldn't eat swordfish, tilefish, shark, or albacore. I tell them if they eat canned tuna, they need to make sure it says tuna, not albacore. If you have a cat, then we need to discuss that, because you should not be anywhere near kitty litter if you have a cat. There's a problem called toxoplasmosis that you can get from that. And also some people that dig in soil and eat raw meat too can be at risk of having toxoplasmosis.
Now, why should we avoid those certain types of fish?
The concern is the amount of mercury in those fish.
So at 7 weeks, I've come in, I've had my first appointment. Then when do I come see you again?
So then the routine OB care, I see people usually a couple of weeks after that, and that's when you have your physical examination. And a lot of things that I tell them about those do's and don'ts of pregnancy, of course, they don't remember. They have questions about that again, so we go through it again. After that, the standard care is you see me every 4 weeks until 28 weeks, then every 2 weeks until 36 weeks, and then every week after that. At 19 weeks, we get the anatomy scan ultrasound. So for the patient, that's the most exciting one, because that will tell the sex of the baby. For my purposes, it's an exciting one because I get to see that all the organs are normal and make sure there are no problems. So the motivation for doing that test or that ultrasound is different for patient and doctor. So that's why we wait until 19 weeks. Then at 28 weeks, you have to be screened for gestational diabetes or diabetes in pregnancy. You're checked to make sure you're not iron deficient, that you don't have iron deficiency anemia. And sometimes we repeat an HIV screen at that time as well. Then from 28 to 36 weeks, at 34 to 36 weeks, there's a swab called a Group B strep swab that we do with the vagina. It's not an infection. It's a normal bacteria that about 40% of women will have, but babies aren't born with it. So if your vagina is colonized with Group B strep, we treat you with antibiotics during labor.
Gotcha. So one of the things that I see that you're really emphasizing about obstetrical care is that it is extremely important that you make sure and schedule routine appointments with your obstetrician, because there are different tests that you have to do at every single point along the way.
Right. And even when we're not doing blood work or a specific test, every time a woman comes in, we're checking the urine. The reason we do that, we're looking for sugar and protein. If you have a lot of sugar in the urine, then you might be diabetic sooner than 28 weeks. We check for protein because if you have protein in your urine, we have to worry that you might have preeclampsia or toxemia of pregnancy, and that's a blood pressure issue. So we're doing that at every visit. And then usually after 20 weeks, we also measure the distance between your pubic bone and the fundus, or the top of the uterus. And that gives us an idea about baby's growth. So it should equal the number of weeks you are after 20 weeks to within a couple of centimeters.
Understood. So, well, now you talk about getting an ultrasound. How many ultrasounds should you get during pregnancy? And What is your opinion about the 2D ultrasound versus the 3D ultrasound or 4D ultrasound? What is your opinion about all these different types of ultrasounds?
So that's always a big question. So basically, insurance-wise, insurance will only cover an ultrasound at about 19 weeks for the anatomy scan. And unfortunately, there are a couple of insurances that won't even cover that.
Wow.
After that, insurance will only cover an ultrasound if it's medically indicated. So if I'm afraid your baby's too small, if I'm afraid your baby's too big, if you are gestational diabetic or you have this toxemia of pregnancy, there are some reasons why we have a medical indication to do ultrasounds. So not everybody gets ultrasounds every 2 weeks during their pregnancy. The 3D ultrasound, to me, in my practice, that is pure photography. So that's not something that's ever covered by your insurance, but some couples really like those pictures and they get a video, and sometimes pictures can be quite cute, but it's pure photography.
Now, there's a 4D ultrasound also?
Yeah, there's 3D, 4D ultrasounds. So, to be honest, I don't know what the difference is between the two.
I didn't either. I just read about it. I was wondering myself.
So with 4D, they can kind of see it in real time, whereas with 3D, they're just taking images.
You would add the time element, I guess. You get to see the movement and everything else. So, well, that's fascinating. So, so basically, you want to stress here about obstetrical care is you want to emphasize that women should make sure they're visiting you routinely, that they make sure that they see you on a regular basis, because there are different testing, different tests and different procedures that you do during every single visit. Anything else you would like to emphasize to a patient who is pregnant, who is wondering about seeing a doctor or wondering how they should see a doctor or who should take care of them? Anything you'd like to emphasize to that patient?
Yes, one thing, you have to get OB care if you're pregnant. It really changes the outcome of the pregnancy. It can prevent prematurity. It can help to prevent too much weight gain in pregnancy and therefore becoming diabetic and having issues during delivery. There's so many things that are prevented by good routine OB care. We also make sure that you're on your prenatal vitamins. So folic acid is extremely important very early in the pregnancy, before 12 weeks. We like for even 3 months before you even get pregnant, we like women on folic acid because it can prevent neural tube defects or spina bifida. And also there's some evidence it could decrease your risk of first trimester miscarriage. So that's miscarriage before 12 weeks of gestation. And it's important to keep all your visits so that we're able to get the timely testing performed. And I feel that most of my skill in looking after an OB patient is in that 40-week period. The delivery time to the patient, that they think that's where the most skill is, and there's skill involved there too. But most of the work is making sure that you get to that safe time. So it's extremely important.
So, and intrinsically what you're saying is that if you're not getting routine care, you're really not doing what's best for yourself, and you're not really ensuring the health of your baby.
You're definitely not ensuring the health of your baby. You really need routine OB care. A lot of women quit smoking when they have routine care. A lot of women will eat better when they have routine care. It
provides a good focus for them while they're, making sure they're seeing their doctor and making sure they're getting feedback, making sure they're having testing done, making sure they don't have diabetes, making sure they are not having any problems with their blood pressure, all of these other things to ensure their health so they can make sure and ensure the health of the baby.
Correct. It's just so important.
Excellent. So, well, as I mentioned, Dr. Cadigan is an obstetrician gynecologist here in the Knoxville area. Dr. Cadigan, would you like to tell us about your practice?
Yes, my practice is alongside Park West Hospital. It's in a building called Physicians Plaza. I'm in practice with my husband. He's Dr. Schroeder. We're called OBGYN Professionals of East Tennessee, and our phone number is 865-531-3303.
And through the magic of television, all that information will appear on the bottom of your screen. So if you have any additional questions, if you want to schedule an appointment with Dr. Cadigan or with her husband in their practice, you'll have that information on the bottom of the screen so you can make sure and contact them. So Dr. Cadigan, thank you so very much for joining me here today and giving me all that wonderful information. It reminds me of when I was taking, when my kids were getting, anyway, just long time ago, brings back the good memories, very much so.
Good.
Well, and I'd also like to thank you all for joining us here on this podcast episode of Doc Talks, produced by the Knoxville Academy of Medicine. And we hope that you have a wonderful day. Thank you so much.
This episode of Doc Talk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.